Welcome back. In tonight's KX Conversation, we welcome Dr. Stephen McDonough.
Dr. McDonough is a pediatrician who's been licensed in North Dakota for more than 40 years. Dr. McDonough, November became the deadliest month in this pandemic. 37 deaths were announced just today. We're at 317 for the month with a week left before December. Why is North Dakota's death rate so high?
Well, we're an absolute disaster. We have had the highest outbreak in the world for several months, the highest death rate in the United States for several months. It's widespread everywhere in North Dakota, rural areas, urban areas. Cass County, Fargo is actually doing among the best. They've had a good mask wearing there for quite a while. And your chances of dying of COVID is twice as likely in Burleigh County as it is in Cass County, and it's even higher in Ward County. But if you look at some of the rural counties, we have 5 counties in North Dakota that have a higher cumulative per capita death rate than New York City. So since the beginning of the pandemic, we have 5 counties in North Dakota where you're more likely to have died of COVID than living in New York City. And we all remember what New York City was like. It's devastating. It's tragic. Much of this could have been prevented with better health leadership from the state. And it's just very, very sad.
Yeah, you wrote a pretty impactful letter to the editor that you sent to several newspapers around the state last week, and we have it up on our website. Do people need a wake-up call or a reality check leading into the holidays?
Oh, definitely. If you go onto the Georgia Tech website and you estimate the size of your Thanksgiving gathering, and you know what county you're in, you can estimate your risk of having someone in that group getting COVID. For example, in Burleigh and Morton County, if you have a Thanksgiving gathering of 15 people, there's a 75% chance that one of those 15 is going to have COVID. If you have grandma and grandpa in that group, it's possible they're going to be in the ICU in 3 weeks or even dead in a month. So really recommending that for your Thanksgiving, you have it with your immediate family. You wear a mask when you go out in public. If you're going to drop food off with grandma and grandpa, they aren't able to cook, then go ahead and do that. But don't get together in close settings. It's been devastating in the rural areas because people have not been wearing masks. A couple months ago, we were among the lowest in the country for wearing masks, and we're paying the price for that right now. And we need to change what we're doing, otherwise Christmas will be a disaster.
And with that significant number of deaths today, the state blames a lag in reporting over the weekend. Are we becoming numb to those numbers?
Well, there's been way too much happy talk by North Dakota leaders. It's absolutely garbage that 37 deaths in one day is not something to be concerned about. If you just go onto the website for the health department, you look at the deaths that have been going up, it's just shooting up like this. The curve is just going up tremendously. There's been a much more minimizing of where we are. Again, we are the worst in the world, the highest death rate in the United States. We need to be wearing masks. The mask mandate was good on November 13th. It should have been done 2.5 months before. And there's still places in Bismarck where people are eating out and not wearing masks, and they're going to hotels and shopping and not wearing masks. We need to take this seriously.
Dr. Stephen McDonough, thank you very much.
Thank you. Happy Thanksgiving.
You too.